Measles cases are on the rise in Canada. Tuesday, we learned there are 30 confirmed cases of measles in Quebec, and this morning there are now more than 130 confirmed cases in Ontario. The U.S. is also seeing a huge surge in measles cases in many states, including the death of a child in Texas. All these infections can be prevented. Joining us now is Chief Provincial Public Health Officer Dr. Brent Roussin. Good morning, Dr. Roussin.
Good morning.
Thank you so much. Now, even in February, we had 5 cases of measles here in Manitoba. How dangerous is measles?
So measles is a highly infectious virus. It's one of the most infectious viruses that we have, and it can cause very significant complications: ear infections, pneumonia, and severe neurologic complications. So we see people admitted to hospital with it, and we can't even see deaths with measles. So it's a very significant infection.
And it spreads very easily. Very
easily. It's one of the most infectious agents we know of.
Wow. Okay. So it's so preventable.
Absolutely.
And what does it take to prevent measles?
So it's part of our routine immunization childhood vaccine program, and everyone will be offered those vaccines at age 1 and then preschool, and that's high 90% protection against measles.
Mm-hmm.
And so we've seen over the years some diminishing of the uptake of our vaccines overall, and when we see that happen in geographic regions, that sets us up for outbreaks such as this.
And any child under a year who's never been vaccinated, they're very susceptible as well.
Absolutely. Those under a year are quite susceptible, and then those with underlying health issues as well.
We're hearing that in the States they're having measles parties in some parts where there's high rates of infection. Not a good idea.
Absolutely not. And this is a mistake that people are making, confusing measles with rubeola, which is German measles, which people will talk about.
Okay.
And that one is typically a much milder infection. And in the past, before vaccines, that's what people had. Measles, 1 in 10 people will have very, very severe complications at a minimum. So not a very good party. And people should be doing whatever they can to prevent measles, and our vaccine is the best way of doing that.
And you can get that at any time?
Yes,
Okay.
Yeah, we have plenty of vaccine available, and so speak with your healthcare provider, and we are happy to provide it.
Okay, let's switch gears now. Influenza A, there are many cases right now. In fact, it's late in the season, but you're seeing a lot of them. What are you seeing right now?
That's right, yes, we're seeing a significant surge of influenza A over the last number of weeks. So that in and of itself is not usual. It's a timing that's unusual. We're seeing this very late surge of influenza A.
Okay.
And with that, like we see every year, we see complications with that. We see people hospitalized, see people in ICU, and then unfortunately we can even see deaths with influenza A. And again, the vaccine is effective against influenza A, and we see that spelled out in our ICUs. We mentioned last year in our ICUs, when we look back, there was no one in the ICU with influenza who had been vaccinated, and we're seeing that same pattern again. We just don't see people having severe complications who get that vaccine.
But you are seeing a lot of people who weren't vaccinated, and it's causing a lot of issues in the hospital system right now.
Absolutely, absolutely.
Okay, what are we looking at in terms of vaccination rates for the flu shot?
Yeah, so where we are right now, we're about 23% overall in the province. Last year, this time, we're about 25%, so we still see that downward trend.
Mm-hmm.
For those over 65 who are more at risk, very similar to last year, 59% versus 58% this year. But we're telling Manitoba it's still not too late. We're still seeing this surge of influenza A right now, so certainly if you haven't had a chance, get that vaccine now. And every year we're always at risk of a second wave. And that second wave can be influenza A, but it's often influenza B, and influenza B is also covered in the vaccine. So it's not too late to get vaccinated.
Well, how about COVID-19? What are we looking at for numbers there?
COVID-19, we saw our peak in the fall and sort of lower rates since then, but it's still around, still causing trouble, especially in those who are at a significant risk of illness.
What are the vaccination rates there?
Vaccination rates again are fairly low. Again, a few percentage points down from last year, where last year we saw about 19%. This year we're seeing about that 15-16%.
Does it concern you that fewer people are getting either vaccinated for measles, influenza A, or COVID-19?
It's certainly a concern in the public health area. We want to ensure people are aware of the benefits of these vaccines, the accessibility of these vaccines, and the ability to speak with your healthcare provider. If you have questions, speak with a trusted source and go over your questions. Make sure you're heard, your issues are heard. But we have a lot of dedicated healthcare professionals in Manitoba are here to speak to you about vaccines, because we know it's the best way to protect yourself and others.
Okay, thank you, Dr. Roussin, for your time today. We
Thanks
really
so much.
appreciate it.